1, 2,
And review, somebody email.
Oh shit, almost got some blood going. Oh, he's wearing it too.
You're in the bay. Once you get over to the bed, we'll give you the story. Everything's going to happen super fast. Welcome to the emergency room.
I lost the phone.
It's,
300 please.
I'll keep you on guard again.
Pulse check. No pulse.
no more pulse.
Yeah. Here, what are the ECMO people say? And her blood pressure is off the dropping.
45 minutes of CPR and no return of circulation. Okay.
Oh.
All right, guys, let's talk about a med that we use quite a bit in the ER, especially on the trauma side of things, and that's going to be lidocaine. Now, in ACLS, lidocaine is a cardiac drug, but when you apply it externally, it numbs. It's a really good numbing agent. And then in the interstitial spaces, it's also a very good numbing agent. Okay, and so let's pretend that you're working in trauma and you have a patient that comes into one of your minor trauma rooms or maybe even a hallway, right? And they have a lac that goes from the hairline all the way down to the eyebrow. Okay, the physician will look at you and say, can I get some lidocaine, right? Your response should be with or without. Okay, now the importance of that is lidocaine comes mixed either with nothing and it's just lidocaine, or it comes mixed with epinephrine. Okay, and so if you have two patients, one that again has the lac from the hairline to the eyebrow, and then you have one that has a pretty good lac, across the top of the hand. Okay, you're going to have to sew both. Okay, and both of them are going to require 2 versions of lidocaine. So the person that's going to be getting the lidocaine with epinephrine or with epi or just with, that's going to be the lac that's from the hairline to the eyebrow. Why? Because there's a lot of vasculature in the face, right? And so you want to use the lidocaine with when you have a strong chance of bleeding occurring. Okay, whenever you stick and poke or whatever, and there's a really good chance of bleeding. So the lidocaine with epi will go through and numb the area, and then the epinephrine will go through and vasoconstrict the area to prevent bleeding. That way you don't get blood in your eye, blood in your face, make a huge fucking mess, and then everything is just to hell. Okay, and then the person with the lac on their hand or the laceration on their hand is going to be the lidocaine without, because you don't really need to worry about bleeding as much, right? With the face, so anything with like the face and the mouth, let's say they're going to drain an abscess in someone's mouth because they just nasty and don't brush their teeth, or like they have, a lac on their face or something, right? You're going to use lidocaine with epi because that epinephrine, again, is going to go through and constrict the vessels inside and mitigate a lot of the bleeding. And then, just a lac on the hand, arm, leg, wherever, ass, whatever, you're going to be using lidocaine without, because you don't necessarily need to control bleeding that much. Okay, so that's one of those meds that there's not going to be an episode on, but it is a med that if you plan on getting into emergency medicine, you're going to be using a little bit, especially if you're in trauma, you'll use it quite a bit. But in the emergency medicine world, you will be hearing Lido with or Lido without. Okay. And so like just knowing that difference with epinephrine, you're trying to control bleeding because it's in a sensitive area, or Lido without because you're not in a sensitive area and bleeding and hemorrhage is not necessarily your top concern. Okay, so keep that in mind. Lido with bleeding concern, sensitive area, mouth, face, stuff like that. And then Lido without is going to be unsensitive areas. Hemorrhage is not your main concern. Okay, so just keep that in mind. Lido with lidocaine with epinephrine or lidocaine without epinephrine. And they usually come in like a pretty good size plastic vial, right? 20 mLs. is usually what you'll use for like a lac repair or something like that. All right, guys. Stay tuned for a drug that I'm going to be putting up. I'm going to be putting it in critical care, and I might even put it in peds as well. It's going to be racemic epi. Now, in pediatrics, you went over racemic epi as, like a med that, you give for like a bronchospasm or something like that. If albuterol isn't working or it's an allergic reaction like peanuts or something like that, you'll give racemic epi and then, nebulize it and send the kid on their way. But what they don't tell you in school, or maybe they did tell you in school because I'm not I'm not in your program, is that racemic epi in the pediatric population is a high alert med. It is as sensitive as potassium is. Okay, I did not know that until someone actually brought it to my attention that a physician has to be present in the room when giving it, and respiratory has to give it, and then there is a very, very, very particular way in giving racemic epi. And you can give racemic epi to adults, but it's namely for the pediatric population. I'm going to add it to the adult population too, because you get people that eat stuff they're not supposed to, and then their throat closes up, and then all of a sudden you just lost your airway, and you're going to have to crike them or, trach them or whatever, and all that could have been avoided if you would have just gone through and potentially given a dose of racemic epi to this adult. But it is a very high alert med. From my understanding, a physician must be present in the room when you do it. And on top of that, like RT is usually the one who gives it. So yeah, it's almost like the reversal agent for prop. You don't usually give the reversal agent to propofol unless neurology is standing at the bedside. It's one of those kind of meds, right? And if you didn't know that, then yes, like there is a reversal agent for propofol. And usually, if you're not overdosing them, then usually neuro will want to give it. That way they can do a quick neuro assessment, and then you can put them back under. So be expecting that. Racemic epi is going to have its own episode. And yeah, you have lidocaine with epi and lidocaine without. All right, guys, enjoy the other episodes.